This patient has African trypanosomiasis, a disease better known by the name of sleeping sickness. Transmitted to man by the tsetse fly, this fatal disease threatens some 60 million people, mainly in sub-Saharan Africa. In 2006, there were 17,000 reported cases, but according to the WHO, 70,000 people suffer from the disease.
At first, you don't realize that you're sick. You just feel a bit tired. Then after a while, you start getting headaches. It's like malaria. And then, little by little, you get really confused, eventually going mad, and then finally dying.
Most patients are only treated at the advanced stage of the disease. They receive malarsuprol, a treatment first introduced 60 years ago. It's a derivative of arsenic and highly toxic. It kills 1 patient in 20. Until recently, the only alternative was eflornithine. But a new treatment is now available. It's the result of 3 studies conducted by Epicentre, an epidemiological center created by MSF, and the DNDi, a foundation that develops medicines for neglected tropical diseases. Started 9 years ago, these studies now show the efficacy of a combination of eflornithine with nefertimox.
We can give the patient a 98% guarantee that he will be cured with this treatment. What's more, when compared with eflornithine alone, this combination is much easier to tolerate, because when we combine the 2 medicines, we reduce the total dose of each one, which means that the toxic effects of each medicine are also reduced.
For the patient, this means less side effects in terms of fever, infections, diarrhea, skin reactions, high blood pressure. But above all, it halves the risk of severe complications. The new treatment is also easier to administrate than eflornithine, which when used alone requires 56 perfusions over 14 days.
With the combination of eflornithine and nefertimox, we reduce the number of perfusions to 14, administered over 1 week only, so we reduce the number of perfusions by 4. Plus the number of perfusions is reduced from 4 times a day to twice a day, which is far more adapted to the working routine in the bush hospital and health centres.
The WHO has been asked to include this new treatment in its list of essential medicines. If it agrees, it will recommend its use. Each country affected by sleeping sickness will then be able to adopt the treatment. We expect the WHO's response in March.